I'm pleased to be here to talk about and emphasize the remarks that my colleagues are making regarding small businesses. In my 10 years of public service as a state legislator, as a candidate for the U.S. Senate, now serving the U.S. Senate, I've heard story after story after story from small businesses who say there are no affordable options for us to be able to provide health care. I remember stopping in a cafe in Mill City, Oregon last year, and this was a three-generational team. The grandmother, the daughter, and then the grandchildren were working in this cafe. And I asked her how things were going. She said, you know, things are going pretty well. We're surviving in this economy. It's a small operation. Everybody knows us. People stop by. But for this, I'm terribly afraid about my children, my grandchildren getting sick, and as well as myself, because we have no health care. We can't afford it. The margin isn't there. There are no affordable options for small businesses. That is a message that reverberated for me year after year, and I was determined here in the U.S. Senate that we had to do something about it. This is our opportunity. In fact, the very heart of this health care reform is an exchange that allows small businesses to join a large pool and have much enhanced negotiating clout to get more health care and cheaper health care. And it does something else. It brings together numerous plans so that there's competition. So now a small business isn't saying, I have 6 employees and I want a health care plan. That has been a situation where that small business is like a lamb to the slaughter. They can't get a good deal. In fact, almost $1 out of $3 for a small business in health care is paying overhead. They get a significantly worse deal, estimates of about 18% worse deal than larger companies. So why not enable them to all join together through this exchange and negotiate a fair deal? That's at the heart of this bill. So these two components, you have pooling, so you have increased market clout, and you have competition. These are powerful market-based instruments we can bring to bear to greatly improve the situation for small businesses. Now, in the Health Committee bill, it has a very similar structure to that my colleague was discussing for finance. As we wrestled with this exchange, we said, let's make this exchange grow from the initial plan, which was businesses of 10 and under. Let's make it 50 and under, and let's give states the option to lift it all together. And so that, I think, has gained traction, that we need to make sure all small businesses have the opportunity to be part of a large pool and gain a competitive, market-based, good deal in our economy as part of a fundamental aspect of this health care reform.